Hi class, my name is Jamie Brochard. Our group is the Page Turners and we will discuss interpreter use in healthcare. The United States is one of the most diverse countries in the world with the most expensive healthcare system, with the highest spending based on gross domestic product share and a high volume of diversity within our country. It is vital that our healthcare system make efforts to improve communication between patients who are deaf and those with limited English proficiency. Professional hospital interpreters serve to increase patient satisfaction, improve adherence and outcomes, reduce adverse events, and limit malpractice risks.
Hi everyone, my name is Will Etchells and I will be discussing the issue description. The issue that will be our focal point for the purposes of this presentation is the problem in the communication gap between patients and the hospitals providing the care. Mara Yudelman with the National Health Law Program stated that if you cannot communicate with a patient, you cannot provide care. And I found this quote is so simple yet so important to the topic of healthcare interpretation because it's something that can be easily avoidable, yet so many factors come into play. A survey conducted in 2016 of 4,586 hospitals presented that only 56% of hospitals offered some type of linguistic or translation services. This was hard to grasp when conducting research for this project because the United States is known for its diversity, yet only a little over half of the hospitals in the survey provided some type of linguistic services. We as a team believe that as the United States becomes even more diverse, the need for some type of translation service should be in place at all hospitals, especially in high diversity areas. And according to the Agency for Healthcare Research and Quality in 2014, nearly 9% of the US population is at risk for adverse events due to language barriers. And this is because the medical staff is having to rely on non-professional translators such as the patient's friend or family member describing symptoms that the patient has to the doctor or advising staff with little to no medical training or knowledge. A report from the University of California, Berkeley School of Public Health found that 35 cases of malpractice in a study of almost 1,400 claims, it was 1,373 claims, were linked to inadequate language access, which could, in hindsight, be easily avoidable. And we believe that in the area of the hospital interpretation, a change should be made, and to discuss the goals that we feel will help drive the change will be presented by Laura next. Thank you.
Thanks, Will. My name is Laura, and I will be discussing the goals of adding an interpreter for patient care. Effective communication is vital in all aspects of care, especially to providing quality of health care. Our mission in this project is to create a framework to improve patient health outcomes for patients that experience language barriers. Instilling trust in our patients and making them feel more comfortable is very important. Promoting accurate decision making and communicating with the patient helps their care go a long way. The average American cannot understand medical terminology, let alone somebody that does not speak English as their first language. Providing better long-term and preventative care is the goal with adding interpreters for patients to understand their own care. Next up will be Aaliyah discussing the possible barriers.
Thank you, Laura. As with every goal, there is at least one barrier that keeps it from being achievable. My section focuses on the barriers to interpreter services. The big question is, if interpreting services are available, why aren't they being utilized more? As the world becomes increasingly more diverse with people of different cultures, communication styles, and languages come together, receiving effective health care that a patient can understand is key to the quality of their care. Language barriers are defined in this case as the inability of providers to directly communicate with their patients well. And this can lead to a variety of less than optimal outcomes like non-compliance and worst of all, death. Unfortunately, not only must patients and caregivers deal with language and communication barriers, they must also contend with the barriers in accessing appropriate interpreting services. A study in Switzerland focusing on family and pediatric physicians facing language and barriers identified several factors to the low usage of interpreting services. Although these findings were from a Swiss study, the implications can be found in the US as well. Organization and financial costs were the top reasons why interpreting services were underutilized. More than half the physicians that participated noted the amount of effort it takes to acquire and put in place interpreting services, making the whole ordeal difficult to achieve a positive result. Some of the Swiss physicians stated not being used to working with interpreters, as well as lacking the knowledge on how or where to obtain those services. Financial costs were not too far behind, with over 53.7% stating that interpreting services were considered too expensive. One interpretive service has been quoted at about $3.29 per minute with a minimum of 30 minutes, bringing the total cost to about $98.62 per session, often with providers eating the entirety of this cost. Another financial cost issue is the lack of funding for providers to comply with the federal law requiring interpreting services to be provided at no cost to the patient. In the US, while interpretive services are required by all providers receiving federal funding under the Title VI of the Civil Rights Act and Title III of the Americans with Disabilities Act, it is still costly to obtain these services. But the benefits negate the costs if applied properly. One study states that the average limited English proficiency patients, or LEP, on average have higher costs associated with their care than English proficiency patients due to more patient visits, longer length of stays, and higher readmission rates when interpretive services are not utilized. When properly utilized, LEP patients' costs decrease due to providers being able to properly assess their patients and reduce the overall medical waste. If it's not finances, it's the interpreter availability that's an issue. Unfortunately, there are not enough medically trained interpreters to staff facilities in person effectively. This is one reason why providers will lean on family members to translate, even though there are a whole bunch of ethical issues to this. The medical trained interpreter shortage has worsened over the COVID-19 pandemic due to reasons like interpreters not receiving proper PPE, and this has resulted in some of them contracting COVID themselves. Another barrier to overcome is physicians' attitudes towards interpreting services. Some of them find it to be cumbersome, and they have some uncertainty if the right information is being translated properly. They also would lean on family members because sometimes it's a lot more convenient rather than having to track down the machine and use it and wait for the interpreter to come online. Next will be Sheena talking about possible solutions to overcome these barriers.
Hi everyone. Thank you, Aaliyah, for talking about barriers of using interpreter services. My name is Sheena, and I'm going to be going over the solutions. So healthcare facilities can improve usage of interpreter services through many different avenues. In order to get our patients on board with using interpreter services, we need to get our staff on board first. We could do this in a variety of ways. We can offer incentives to staff. We can also just require them to use the interpreter services. We can set up alerts in patients' charts so that providers are aware ahead of time if a patient needs an interpreter service. And we can also schedule more time for these patients so that no one feels rushed, everyone can use the services provided so that the staff is happy and the patient is happy. We need to reduce patient apprehension towards using language services. By increasing awareness that the services are available, this should help educate patients that they can request them at any point in time during their visit. There are a couple ways we can encourage the use of interpreter services. One way is we can put posters up around a healthcare facility to offer a visual cue for the services so that patients feel a little bit more comfortable requesting them since they will be advertised. Another big component to this is offering paperwork in a patient's written language, making them more comfortable with the health care that they are receiving. For example, we can offer discharge paperwork in the patient's primary language. Thank you for listening to Solutions, and now on to Jamie for the conclusion.
In conclusion, by offering interpreter services and having staff utilize them, healthcare facilities can improve trust and promote educated decision-making by patients. With the use of interpreters, hospitals can bridge the gap of communication between providers and patients who do not speak the same language. This will improve overall understanding, patient health outcomes, satisfaction, and decrease adverse events. Thank you.